Hi everybody and welcome back to my channel. I want to dedicate today's video to talk about healthcare coverage and specifically compare the two types of healthcare plans that are available in the United States and then specifically in California. I want to touch on having a PPO plan versus having an HMO plan, specifically when it comes to cancer treatment. Obviously, insurance coverage and healthcare coverage is a hot topic for politicians and cancer patients. So I thought it would be an informative video to make, especially if you are somebody who is preparing to undergo cancer treatment and you have the option to choose between PPO and HMO. I think that some things might be useful that you can learn from my experience. But before I dive into my comparison, I do want to say that you shouldn't think that if you have an HMO plan that your treatment or your care is going to be any worse than if you have a PPO plan. Because in the United States, all oncologists and all cancer centers have to abide by the standard of care. And the standard of care is defined as, and I'm going to read this so that it's 100% correct. Standard of care in the US is defined as the proper treatment for a certain type of disease and that is widely used by healthcare professionals. So what that means is any time that an individual is diagnosed with any type of known disease, oncological or not oncological, but we'll talk about oncological diseases here, there is a standard type of treatment that oncologist is required to provide to their patient. And it's something that any patient can look up and research, and it's not a mystery unless you have some sort of very particular case. But if it's a classic presentation of disease, then it's very straightforward and it's a standard of care that you will receive regardless whether you have an HMO plan or a PPO plan. But let's look at some specifics. I first want to start off with my scenario and where I had an HMO plan and then where I had a PPO plan and why I'm able to compare. So for those who don't know the background, but I was initially diagnosed with stage 3 with symptoms, which is stage 3B, classic Hodgkin's lymphoma. And I underwent the standard of care chemotherapy protocol, which is called ABVD, for 6 months. I received 12 infusions of that chemotherapy treatment. And then within 6 weeks of the treatment being complete, the chemotherapy treatment, I relapsed. And then the second line of care was proposed to be an autologous stem cell transplant, which also required chemotherapy or immunotherapy in the beginning, then stem cell transplant itself, and then maintenance therapy, which I am undergoing right now. So for the first line of treatment, which was the chemotherapy ABVD, I had a HMO plan, which was Kaiser Permanente, Northern California. And then for the second line of treatment, because I had the choice, I had a PPO plan, specifically Aetna PPO. So now that we have this information, let me dive into the comparison. One of the biggest differences that I will call out when it comes to HMO and specifically Kaiser HMO versus a PPO plan, my Aetna PPO plan, is the oncologist face time. So when I was initially diagnosed and was going to receive treatment through Kaiser, I saw my oncologist in the beginning before chemotherapy started. After I had my PET scan. So after I had my PET scan, I had the official oncologist visit where the oncologist told me what the treatment plan would be, what my options were. And once the treatment plan was selected, The next time I saw my oncologist was after 10 chemotherapy infusions. So right at the end of chemotherapy. I did see her a few times because I had a few emergency room visits, and because it was all within the same facility, she came in to check on me. But there were no specifically scheduled oncologist visits that were additional or standard while I was undergoing chemotherapy. And that to me was okay because I didn't know any different. But when I started my second line of treatment and I had a different oncologist through a different system, through a PPO plan, I actually had, and I still do, have monthly oncologist visits that fall between my immunotherapy sessions. So I had that prior to transplant, and I have one oncologist that's my main oncologist that I see on a regular basis. Then I receive the immunotherapy treatments. Then I, on a regular basis, see my transplant oncologist, which is an additional human being and additional appointments. And then the same thing goes for right now, maintenance treatments. Between my maintenance treatments, I see my oncologist regularly. So that's one really big difference that I want to call out is oncologist FaceTime. And I will say that it doesn't mean that your treatment is worse. But when you don't see your oncologist on a regular basis, which is something that I didn't know, especially when I was going through chemotherapy the first time, you have to be very vocal. And if you're very vocal and you're a patient who's very aware and will say, well, I have this, or I have this, or I have that, and you're going to be straightforward about it, that's fine, because you can always reach out to your oncologist and they will always get back to you. But for patients that are, less versed in healthcare, they don't know what to expect. I think that it's really crucial to be able to see your oncologist on a regular basis between treatments, because your oncologist will ask you the right questions. So if oncologist specific FaceTime is important to you, then I would hope for a PPO plan for you. I would suggest a PPO plan for you. The next topic that I want to touch on when it comes to comparing HMO and PPO plans is medication and treatment protocols. So when it comes to HMO, typically the doctors within the HMO system, and specifically in this case within the Kaiser system, they are encouraged to prescribe a certain protocol. Like for example, for Hodgkin's lymphoma, it was the ABVD protocol. That's the standard of care. That's what they are encouraged to suggest. There are other protocols that are available that are becoming more and more commonplace. So it was something that I brought up to my oncologist, and my oncologist said, well, if that's the treatment that you want, we can administer that as well. But once again, this is not something that was suggested by them. This is something that through my research and through a second opinion, I knew to ask about. So when we're talking about HMO, you need to understand that those doctors are more constrained by the system that they're in, and they will be suggesting the standard protocol. So you will sort of have less of a choice, right, than you would have with PPO, right? So that's when it comes to, treatments and what treatments are available, like what treatment protocols are available, right? If you want to go the standard route, HMO is totally fine. If you are somebody with a more difficult case and you might need a different route, then it might be easier with a PPO provider. But that doesn't mean that if you ask the question, the HMO provider might not be able to give that to you. That's still possible. So I would say that's where HMO is, subpar to PPO, just that you have less of a choice when it comes to protocols. What I will say HMO does better, that I have seen, is we have to understand that if an HMO provider, specifically a Kaiser provider, prescribes something to you, it's automatically approved by your insurance because it's a Kaiser provider, it's Kaiser insurance, they know what to prescribe, you know what you're gonna get. With PPO, this is where it gets a little dicey because your oncologist that you're seeing through your PPO plan might be more progressive, but the insurance will be like, well, but there is, a substitute medication that'll work just fine, but it's not that. I have seen a few explanation of benefits, or I would say rejections that Aetna did because my oncologist wanted to go a less traditional route as a preparation for auto stem cell, and basically Aetna rejected that, and they said we won't allow that. You can go the traditional route and then go into stem cell, which didn't actually make a difference in the end. But I will say that getting refills, getting certain medications becomes a little bit more difficult. There's a little bit more of a wait time. To give a concrete example, I needed iron infusions, and it took almost a week to get that approved, and then it took almost a week to get that scheduled, just because obviously infusion center is backed up, and so it took me a really long time to get that medication. If this was a Kaiser situation, I probably would have been able to get that iron infusion, in a few days, because if a doctor prescribed it, it's automatically approved. So here you could see sort of the pros and cons of, HMO versus PPO and vice versa. When it comes to treatment protocols, as I mentioned, you may just have a little bit less of a choice when it comes to HMO, and I'll give you another example. An autologous stem cell transplant is the standard of care second line of treatment for my case, which was relapsed or refractory disease when it came to Hodgkin's lymphoma. So whether I was with Kaiser, which was HMO, or if I was with Aetna, which was PPO, I would have still received a stem cell transplant. But with PPO, I had a choice between UCSF or Stanford. With Kaiser, I wouldn't have had that choice. I would have been, my only choice would have been Stanford, because Kaiser has a contract with them, right? So obviously this is all bureaucracy, but in the end, I would have received the same kind of procedure. So once again, PPO, maybe just a little bit more choice than HMO, but the same type of treatment, the same type of offering. When you have HMO, you will get sort of the bare minimum required when it comes to scans, when it comes to office visits, when it comes to, follow-ups, right? With PPO, there's a lot more fluff, right? Doctors are able to be more hands-on. There's more support when it comes to, infusion centers. They're just a little bit different. So I would say between HMO and PPO, I would say HMO is kind of like no fluff, down to the point. With HMO, there's a little bit of more of a hands-on approach. If we are to compare emergency room visits when it comes to HMO and PPO, I would say that there's no difference. Obviously, it depends on the hospital that you go to, but essentially, I have gone to Kaiser emergency room because it's right by my house with my new PPO coverage, and it's the same treatment. So I would say that if you're worried about the service that you're gonna get at an emergency room or for an emergency situation, I would say it doesn't matter, right, what coverage you have. It will matter how much you pay for that visit if you have an HMO or a PPO, but as far as treatment or the type of service or help that you're gonna get, you're not gonna see any differences there. Those are all the differences that I wanted to highlight, and I hope that this video was helpful. If you want my opinion in the end, I'll give you my 2 cents, having had both types of medical coverages. I would recommend going the PPO route, even though, right, there's a few hoops that you have to jump when it comes to medications or refills and things like that. I do think it's worth to be able to have more of that FaceTime with the oncologist, a little bit more hands-on care, or a little bit more options when it comes to your treatment. You can do due diligence, you can research, you can get second opinions easier, right? Because if you're within the HMO system, you're only limited to the HMO providers, right? If you have a PPO plan, you can go get a second opinion to almost any physician who, who's a practicing oncologist in your particular field. So my advice, if you have the choice and it's not a big monetary difference, my advice would be to go the PPO route when it comes to your cancer treatment. But always remember that even if you don't have that choice, you will still get treatment in the US for your oncological disease. And you will get the best care and the standard of care that's available in this country when it comes to any sort of oncological diseases.